Hello, my name is Dr. Margaret McLean, and I'm a nuclear medicine physician in the Department of Nuclear Medicine at Kaiser Permanente Santa Clara Medical Center. You have been referred to the Department of Nuclear Medicine because you have recently been diagnosed with thyroid cancer. Today you will meet with one of our nuclear medicine physicians to discuss your diagnosis, the role nuclear medicine may play as a treatment during the weeks following your thyroid surgery, and the long-term management of your thyroid cancer. In addition to nuclear medicine physicians, other members of our department include nuclear medicine technologists and imaging assistants. Your needs and your treatment are our first priority. We will work closely with your thyroid cancer surgeon, your endocrinologist, and your primary care physician. It is our goal to make your treatment for cancer as successful and problem-free as possible. This brief presentation will give you information about thyroid cancer, specialized radioiodine imaging studies, preparations that are needed before your scans are done, and radioactive iodine treatment procedures that may be required after your surgery. Your long-term care plans will be discussed with you in detail as part of our thyroid cancer monitoring service. We hope you will better understand the role of nuclear medicine in your cancer treatment, and that you will feel more familiar with the terms and procedures that you will encounter during your treatment process. There are about 60,000 cases of thyroid cancer diagnosed in the United States each year. We do not entirely know what causes thyroid cancer. Some thyroid cancers are more likely because of a person's genes or family history of thyroid cancer. Some people may have had prior significant radiation exposure, but most thyroid cancers occur spontaneously and have no prior risk factors. The thyroid gland is a small butterfly-shaped gland located in the front of the lower neck. It produces thyroid hormone, which regulates the body's metabolism. Thyroid hormone is necessary for the health of all the cells in the body. It helps the body use energy, stay warm, and keep the brain, heart, muscles, and other organs working as they should. Many patients with thyroid cancer have no symptoms. Some patients may notice a lump in their neck. Others have no symptoms and the cancer is detected during a routine physical examination. Patients may have had imaging scans that incidentally find a thyroid nodule. Thyroid nodules or bumps on the thyroid are very common. Most thyroid nodules are benign or non-cancerous. However, approximately 10% of thyroid nodules will contain cancer. The cancer is usually diagnosed by fine needle aspiration, or FNA, where a small needle is placed in the nodule and a sample of the cells are extracted and examined under the microscope by a pathologist. When a diagnosis of thyroid cancer is made or strongly suspected, the next step is to remove the thyroid gland with surgery. This operation is called a thyroidectomy. After surgery, a radioiodine scan is done to allow our nuclear medicine doctors to determine if and where thyroid cancer may have spread in the body after surgery. This helps your doctor determine if more treatment, like radioactive iodine treatment, is necessary. Usually the surgeon removes all or nearly all of the thyroid cancer during the surgery. However, even the best surgeons may leave behind tiny pieces of thyroid tissue. These tiny pieces are called remnant thyroid tissue. It is important to find out how much remnant thyroid tissue is left behind because it might still contain cancer cells. It is also important to find whether there has been any spread of the cancer to nearby lymph nodes in the neck or to other areas of the body. A diagnostic imaging scan with radioactive iodine is usually done several weeks after surgery. Radioiodine is useful because thyroid tissue is one of very few tissues in the body that absorbs iodine. As a result, thyroid tissue appears bright on the iodine scan, allowing our nuclear medicine physicians to determine if and where thyroid cancer cells have spread in the body. The radioactive iodine scan is very safe and requires no radiation safety precautions to protect those around you. The radioiodine scan requires some preparation before it can be done. In particular, two very important things need to happen. 1. Iodine levels in the blood must be low. This is achieved by following a low iodine diet for at least 2 weeks before your scan. This diet involves avoiding seafood, iodized salt, reducing the intake of dairy products like milk and cheese, avoiding processed foods, and reducing the amount of grains or cereals you eat. The diet is admittedly bland, but it is not harmful to your body for the short time that you will be on it. By reducing the amount of iodine in your system, the remnant thyroid cells become very hungry, so to speak, and therefore will absorb the radioactive iodine more readily at the time of your iodine scan. Number 2, thyroid stimulating hormone, or TSH, levels must be high to stimulate the remnant thyroid tissue to absorb iodine. TSH is produced by the pituitary gland, which is a small gland at the base of the brain. There are 2 ways to create high TSH levels. One way is just to not begin thyroid hormone replacement pills after surgery. As your thyroid hormone levels fall, the TSH level begins to rise. When the TSH level is high enough, usually after about 3 or 4 weeks for most people, you will be ready for the iodine scan. An alternative way to induce a high TSH level is with an injectable form of TSH. With this medication, the patient receives thyroid hormone treatment right after surgery. You will receive 2 injections of synthetic TSH into your muscle tissue. Your nuclear medicine physician will then discuss which option is best for you. When you have been on the low iodine diet for at least 2 weeks and TSH levels are high enough to proceed, you will come into the nuclear medicine department for the whole body radioiodine scan. This is a 2-part test. On day 1, you will come into the nuclear medicine and swallow a small capsule of a short-acting isotope of iodine called iodine 123. This capsule is about the same size and shape as other medication capsules you might have taken. Once swallowed, it is absorbed very quickly. The capsule is tasteless and has no significant side effects. After taking the capsule, you may go home and no radiation safety precautions are required then. On day 2, you will come into nuclear medicine for your whole body scan. It's a good idea to wear loose, comfortable clothes. Try not to wear any jewelry, especially around your neck. You will lie down on an imaging table. You will be carefully positioned on the table and have to remain very still during the scan. The gamma camera will scan your entire body. Additional pictures of your neck and chest will be taken, and a measurement will be made of the amount of iodine seen in your neck. All of this takes about 90 minutes. The process of the scan and obtaining images is painless. Immediately after the scan, you will have a consultation with your nuclear medicine physician, who will discuss the results with you and tell you if radioactive iodine treatment is advisable. Should your scan show that remnant thyroid cancer cells have spread to lymph nodes in the neck or have moved to other parts of the body, radioactive iodine treatment may be used to destroy the cancer cells. Radioactive iodine therapy may also prevent recurrence of thyroid cancer in the future. If you do not require radioactive iodine treatment and you are not taking thyroid hormone, you will be given a prescription for the thyroid hormone medication that you will take for the rest of your life. You can pick up this medication from the local pharmacy on your way home. You can then resume your normal diet as well. If you do require radioactive iodine therapy, please view the radioactive iodine video to learn more about this treatment. After the process of radioiodine scanning and/or radioactive iodine treatment is complete, the ongoing follow-up process begins. You will be assigned a thyroid cancer specialist who will be responsible for your long-term follow-up care. The specialist will be the endocrinologist, surgeon, or nuclear medicine physician who was involved with your care. We will enroll you into our thyroid cancer monitoring service, which is a unique feature of our care here at Kaiser Permanente Santa Clara Medical Center. Our specialty-trained pharmacists and program assistants will work closely with your thyroid cancer specialist to maintain your medication, remind you of regular blood tests and occasional scans, and schedule continuing office visits. Typically, patients are seen by their thyroid cancer specialists every 6 months for the first year and then annually thereafter, or more frequently if necessary. Everyone will have a unique or different follow-up plan. We hope this video has given you a better understanding of what to expect in the weeks following your surgery and the role nuclear medicine will play in your treatment. You can find more details about thyroid cancer, nuclear medicine, and details of the low iodine diet on your nuclear medicine physician's homepage at the Kaiser Permanente My Doctor online website. Thank you.